health nursing practice. Which among the following is the primary focus of community health nursing? Is it A, B, C, or D? Cure, of course, it's not the primary focus. Rehabilitation sa tertiary na ito, tertiary form of prevention, between prevention and promotion of health, which is the best answer. According to your source, Ms. Araceli Maglaya, what is your best answer?
Delta.
Delta. Okay. So with CHN, according to our author, Dr. Araceli Maglaya, your CHN deals both with the health promotion health promotion. Okay, that's Delta, and disease prevention. Pero the topmost priority when you are a community health nurse, it will be the promotion of health in the natural environment of the individual or of the community and or family that you are assigned with. Okay, so that is number 1, promotion of health. Okay, so i-review mo yung answer mo. Yan ba ang sinagot mo during that time? Next, number 2. In community health nursing, which of the following is the unit of service? Okay, unit of service is the question. So what is your answer?
Delta.
Delta, very good. So in the community setting, actually, ladies and gentlemen, baka may sumagot kasi ng community, there are 4 levels of clientele. We have your individual, we have the family, sino pa? The community, and the population group. So ito yung groups of pregnant women, groups of toddlers, mga ganon. So population group. So since the community health nurse addresses the health needs of the community, the basic unit of care when you are assigned in the area is the family. Okay, the family. So the best answer in number 2 is the Delta, the family. Next, number 3. A very important part of the community health nursing assessment process includes community health nursing assessment process. So what is among all those choices here, A, B, C, and D, which is pertaining to community health nursing assessment? Assessment. Alpha, very good. The application of professional judgment in estimating the importance of facts to family and community. Evaluation and coordination. Okay? Evaluation and coordination are 2 separate activities that you do in the area but definitely not part of the assessment process. Delta, carrying out nursing procedures as per plan of action is part of your implementation process. So among all the choices, the best answer is letter A. Next, number 4. In community health nursing, it is important to take into account the family health data coupled with an equally important need to perform ocular inspection of the area. These activities are powerful elements of what? Okay, take note of the key terms. Okay, family health data, ocular inspection are what elements of the process of community health nursing? Is it the evaluation part, implementation part, assessment, or planning? Family health data. So, kukunin mo. I-interview ka, tatanong ka, kukunin mo sa family folder in the clinic, then you are going to perform ocular inspection. So, ano ito? Is this an assessment, an implementation, evaluation, or planning?
Assessment.
Sorry? Evaluation? When you are in evaluation, hindi po siya, the ocular inspection doesn't fall under evaluation. Ocular inspection, it will be, for example, you are assigned to, yung community natin sa somewhere there, dun sa may foggy area, Tublay. Tama ba? Tublay? Oh, mag-ocular inspection tayo. Do you think that is evaluation? Ocular inspection, we are going to
Assessment.
survey the area. This will be part of our assessment, okay? The same is true when you are collecting or validating the family health data. It is still part of the assessment process. Data collection in the family when pertaining to healthcare nursing is your first level of assessment. So ano ba yung first level of assessment? Just to review you, ladies and gentlemen. First level of assessment involves the 5 important data. First is the family structure and characteristics. Ano ulit yung what do we usually include in the family structure and characteristics? If this is a type of family that is matriarchal, ano pa? Patriarchal type, may extended families ba tayo? Okay, so you have to consider those ones. And if these individuals, yung mga individual anong data na yun? Demographics, okay? So the demographic data, so it should be included in the family structure and characteristics. Second level of assessment, the second type of data that you need to collect for the first level of assessment is your socio-economic and cultural factors. We also have the environmental factors, the health assessment of each member of the family, and what are the different values that are placed on health promotion, maintenance, and disease prevention. Okay? Yan. So, ano ulit yung mga data gathering methods natin? Observation, physical examination, interview, review of health records. So, those are examples of these are means actually where you can gather data, particularly now the family or families that you are attending to in the community. So again, the ocular inspection and reviewing or gathering information with regard to the family is considered under the assessment process. Okay, assessment. Next, number 5. In community health nursing practice, a nurse should be prepared to apply the scientific approach, okay, in different situations. This approach ensures quality of care even at the community setting. This in nursing parlance is nothing less than the what? Is it the nursing diagnosis, research protocol, or process? Process, very good. So you take note of the clues in the question, no? Apply the scientific approach. So when you say the application of scientific approach, this pertains now to the nursing process, which provides the framework, okay? The framework in which the nurses uses their knowledge and skills to express human caring and in order to help the clients meet their individual health needs. Okay? Yan. So that is number 5. Next, number 6. The situation. What is the situation? There is a lot of important basic knowledge in the performance of the task of a CHN in relation to immunization and immunizable childhood diseases. The following questions pertain to this. 6. Which of the following vaccines does not contain a live attenuated microorganism? It does not contain live attenuated microorganism. It does not contain a weakened microorganism. Ano dyan? Ano ang sagot? Bravo, very good. Your hepatitis B. Why? Because this is plasma-derived. Your measles vaccine, OPV, or your oral polio vaccine and Bacillus calmette-guerin contains live attenuated microorganisms. Speaking of this live attenuated microorganisms, vaccines in general, anong klaseng immunity ito? Passive or active? There are different types of immunity. Meron tayong naturally active, wait lang, naturally Wait, isulat ko nga, nalilito ako. Na, naturally, naturally,
Active, passive, natural, active, passive.
acquired. Naturally acquired active immunity. Tama, Miss Anamong? Naturally acquired. There are two types of immunity. We have active and passive. And there are still subcategories under this. Meron tayong naturally acquired active immunity. And the other one is artificially acquired active immunity. Yung kabila naman, naturally acquired passive immunity. And the other one is naturally acquired, artificially acquired passive immunity. Oh, where would you classify these vaccines?
Artificial.
Artificially acquired, passive or active?
Active.
Active immunity. Very good. So tandaan nyo yun, ha? Vaccines are classified under artificially acquired active immunity. Sulat ko nga ulit. Nalilito na ako. Artificially acquired active immunity. Okay. Yan. Oh, what about, okay, sige, mamaya na. Okay, next, number, so anong sagot natin ulit? Hep B. Hep B because this is plasma-derived. Okay, number 7. Which of the following vaccine, okay, take note of the question, which of the following vaccines is needed before a child reaches 1 year in order for him or her to be qualified as a fully immunized child? Okay, siguro may mga nalito sa inyo dito. Anong sagot nyo? Before we can consider the child to be fully immunized, what vaccine, okay, what vaccine will be given or what vaccine is needed before the child will reach 1 year of age? Anong sagot nyo?
C.
C. Very good. Charlie is the correct answer. Okay? Why C? Okay? Although these medications are received or are administered or to be administered to a child before the age of 1. Tama naman, di ba? PT, Hep B, BCG. Talaga namang tatanggapin niya yan before he reaches the age of 1. But the thing here, ladies and gentlemen, is the word or are the words fully immunized child. Before he reaches the age of 1, what will qualify him to be considered as a fully immunized child is for him or her to receive letter C, the measles vaccine. Okay? BCG, DPT, Hepatitis B, wait lang, sorry po. Yan. Hepatitis B, asan na? Oh, Hepatitis B is administered at an earlier age, whereas your anti-measles vaccine or your measles vaccine is administered at 9 months. This makes the child, having been received the A and B vaccine, the last vaccine to be administered under your EPI or expanded program of immunization, gives the child or qualifies the child to be a fully immunized individual. Okay? So best answer that you should have chosen here is Charlie. Okay? Your measles vaccine or your AMV. Next, number 8. The following dose of tetanus is given to a mother to protect her infant from neonatal tetanus and likewise providing 10 years of protection to the mother. Okay. What tetanus toxoid number? 1, 2, 3, or 4?
4.
4. The tetanus toxoid 4, okay, the 4th dose that the mother will be receiving in order for her to at least have a 10 years protection from tetanus is your tetanus toxoid 4. Okay, it gives 10 years protection for the mother. Ma'am, naman yung iba. Tetanus toxoid 3 will give at least 5 years protection to the mother. Tetanus toxoid 2, 3 years protection. Tetanus toxoid 1, there is no immunity yet that will be developed if you only receive PT1. Kaya pag binigyan ka po ng PT1, you have to make sure that you will receive your second dose of tetanus toxoid, okay? To at least attain, okay, the years of protection that it could give you. And that is a 3-year protection. Kahit naman hindi ka, tama. For the mothers, okay? Next. So tetanus 1, 2, 3, and 4. The best answer, again, is letter A. Number 9. 10. A 9-year-old child is brought to the health center for consult because of papular pruritic rash with some vesicles on his trunk and back. He has fever and body malaise. Based on your assessment or based on the assessment of Nurse Liv, which illness that does can have? What's your answer? Okay, the presenting signs and symptoms, papular pruritic rash, some vesicles. So pag sinabi mong vesicles, merong konting fluids inside, okay, inside the epidermis of your patient. Although maliliit lang ang mga ito, okay, but they can be sources of discomfort on the part of your patient. Meron din tayong hyperthermia and malaise. So what could be the possible diagnosis for our patient? Is it measles? Is it rubiola? Ano na ulit ang rubiola, mga anak?
Measles,
Mga kapatid. Okay, measles, rubella. What about rubella?
German measles.
German measles. Okay, tandaan nyo palagi yun. Kasi in the board exam, they don't usually make use of German measles. Walang ganon. They usually make use of these terms, rubiola and rubella. Okay? Even for chickenpox, they make use of the term varicella. Bakit po sinabi yan? Okay, so D is varicella. So what is the most probable illness, okay, the diagnosis that we can make with this presentation?
Varicella.
Varicella, very good. So the assessment findings, so papular pruritic rash with a few or some vesicles, fever and body malaise is considerably enough to conclude that our client is suffering from varicella or chickenpox. Okay? Chickenpox. Okay. Yan po. Next is your number 10. Number 10, Nurse Charity is giving health teachings on the preventive measure against Hep B infection. Which of the following is not a part of the health teaching? It is not a part of the health teaching. So first, test-taking strategy ninyo, tignan nyo muna kung what are the different preventive measures that you could consider when addressing hepatitis B infection. And then, if you will be able to identify those kung alam natin, then we will be able to come up with those statements or interventions that do not play a part in relation to Hep B infection. Okay, so saan dyan?
Charlie.
Wait. Okay, so it's Charlie. Avoid eating foods prepared by an infected food handler. So ano ulit? This is more related to hepatitis A infection but not B. All your A, B, D are related to hepatitis B infection. Okay, that's number 11. Next, number 12. Nurse Cecil. Wait lang. Yan. Nurse Cecil gives health teaching to a group of adolescents in a local high school. She is correct. Okay, take note of the words. She is correct when she says that one of the following clients is at risk for developing AIDS or your acquired immune deficiency syndrome. She is correct if she will say that clients who live in crowded housing with poor ventilation puts the client at risk of developing AIDS. Correct?
No, ma'am.
Siyempre, mali. Okay. A young sexually active client with his girlfriend as partner.
No din, ma'am.
No, oo, no. Correct ka dyan, madam. Okay, kasi pinapakita lang po nito na the partner, o boyfriend, kung girlfriend, kung na dyan, the partner is monogamous. Okay? Based on the statement. So do not imagine things, people of the Philippines. Adolescents who are homeless, who live in a shelter, is of high risk for developing AIDS. No. Okay, so again, direct sexual contact ito. So the best answer left is a young sexually active adult with multiple partners. You cannot just get AIDS, but you can also acquire a lot of STIs if you are having multiple sex partners. Okay, so that's number 12. She is correct if she will say letter D. Okay, so it puts you at risk of developing the disease if you have multiple sex partners. Next, Mary brought her Mary brought her toddler home because of exposure to varicella, again chickenpox, in the daycare center. Which statement is true about varicella? Which statement is true about varicella? By the way, before we go further, ladies and gentlemen, what causes, okay? What causes your varicella? What is the causative agent for varicella or chickenpox?
Varicella zoster.
Okay, so we have your varicella zoster virus. Okay, thank you. Yan po ang causative agent ng ating ng ating chickenpox or varicella infection. Your varicella infection is very common, no, among children. So this is very common among children, but once you are exposed, no, sinong nag-chickenpox na sa inyo? Lahat ba tayo? We were able to experience chickenpox? Who? Mr. Abad? Ngayon lang? Hindi na po chickenpox ang term natin. Pag ganon. So if you were exposed to chickenpox before, you did experience having chickenpox before, that when you develop another infection cause or another infection related to this type of disease, you are now considered to be suffering from, Miss Anamong, chickenpox pa ba ang tawag natin? If your chickenpox, no. So ano nang term? When you had a past exposure to chickenpox and then you develop the same condition, that is already known as your
Basta iba.
basta iba. Okay, that is known as your shingles. Okay, shingles. And the causative agent for shingles is your herpes zoster. Okay, herpes zoster. Baka mamaya may magtanong.
Single.
Yeah, shingles, hindi single. Okay? Shingles. Ayan. So shingles. So shingles is caused by herpes zoster. Chickenpox is caused by your varicella zoster virus. So parang nag-progress ka lang, no? But the same, you will experience, no, the same signs. You have a commonality when it comes to the signs and symptoms, no? That's your shingles. After an exposure or you did experience yourself having been diagnosed with this chickenpox, and when you are healed, tapos here comes again another infection that is already known as your shingles, no? Still related with your zoster virus. Yan. Dahil nga single. Is your herpes zoster, okay, causing now your shingles, responsible for your genital herpes? May I just ask? Is the herpes zoster causing the shingles related to or the same microorganism causing your genital herpes? Or you may say genital herpes. Are they the same? Yes or no? Oh my gosh. Am I still with you?
Yes,
Nawawala
ma'am.
ang
Yes,
ayun.
yes, ma'am. Yes, ma'am.
Oo. Paki-confirm kasi nag-blink-blink yung light natin dito sa laptop. Hindi ko maintindihan. Ano, is it the same for shingles and genital herpes? The answer is no. Okay? Baka kasi lumabas sa board exam question. Marami varicella, zoster herpes simplex virus type 2. Okay? Yan yung mga parang nakaka-confuse, no, because of the term herpes. Okay? So for the shingles, we have your herpes zoster, but for genital herpes or herpes, we have your herpes simplex virus type 2. So this is the one responsible for your genital herpes. So ito ay sexually, no, diseases. We can share it. I do not know. Okay? So, Mary brought her toddler home. Which statement is true? Sabi nyo kanina, vesicular. Vesicles are formed. Therefore, eliminate letter D because rush is non-vesicular. Sa first presentation natin, it's vesicular. Therefore, we eliminate letter D. Between A, B, and C, what is the best answer? Charlie. Very good. Varicella has an incubation of 2 to 3 weeks, or if it's in days, at least 13 to 17 days. Okay, so the period of communicability is not more than 1 day before and more than 6 days after the appearance of the first crop of vesicles. Ayan, so medyo umiwas-iwas tayo, no? If you are advised to stay at home because of this infection, please do stay at home. Be considerate with the other members of this class. For example, nasa face-to-face na tayo. Okay, so what is the common medicine that is being used to treat your chickenpox and shingles? Ano yung drug of choice? Baka alam nyo, i-share nyo na. What is the drug of choice for chickenpox and shingles? Letter A.
Acyclovir.
Acyclovir or aciclovir. Okay, so that is the medicine of choice. Kung ang nakita mo is valacyclovir or valaciclovir, if you may pronounce it that way, that is still the same. It is an antiviral medication. Okay, yan po. And of course, supportive care. Okay, supportive care for our patients. They may be isolated from the rest of the household, but please do not forget to provide supportive care to these individuals. Okay? Next, number 14, OPV is administered at what age? Very basic. 14? Ay na, malibat na agad isa. Number 14. What is... sorry. Okay. Number 14, the answer is Charlie, at 6 weeks. So at 6 weeks, with how many weeks interval? Because you receive this for 3 doses as part of the basic vaccines that are being received or administered to our infants. How many doses? And at what interval? So kung binigay mo yung first dose at 6 weeks, when will be the next dose?
1 month.
10 weeks.
Okay. Hindi, masyadong mahaba yung 10 weeks, sir. So you have to, sorry?
Diba 6 weeks plus 4, so 10 weeks.
Akala ko 10 weeks. Okay, sir. Oo, on the 10th week or after 4 weeks from the time that you have administered the first dose. So at 6th week of life, ibibigay na po yung first dose of OPV. After 4 weeks, the second dose, and another 4 weeks for the third dose. So we only have to complete 3 doses for our OPV. Again, 4 weeks interval. Next, 15 to 19, one important tool that we nurses use in the community in the conduct of our activities is the public health nurse bag. Your PH bag is what? According to the community health nurses, what is a PH bag?
Bravo.
Bravo. An an essential and indispensable equipment of a community nurse. That is the correct answer. Okay? So you have to, this public health bag is a very crucial equipment on your part, no, as a PHN. You have to carry this along with you wherever you will be going. Lagi mong dala-dala yan. Dapat kompleto. Hindi yung parang nangyari sa atin, no, na in example na ang laman ng ating PH bags are fruits that we were able to gather as we pass by the households, mga ganyan. So it should be complete with your medical supplies and other materials that you need as you go on with your duty as a community health nurse. So the answer in number 15 is bravo. Next, number 16, the rationale in the use of bag technique. Okay, again, use of bag technique during home visit. What is the main rationale? Or what is the rationale in the use of your bag technique during your home visit? Will it help render effective nursing care to client and other members of the family? It saves time and effort of the nurse in the performance of the nursing procedures. It should minimize or prevent the spread of infection from individual to families. Okay. And it should not overshadow the concerns for the patient. What is the rationale of the bag technique? If we are talking about the bag technique,
Charlie.
what is your answer?
Minimize.
Charlie, from individual to families.
Bravo.
Bravo. Very good. Bravo ka nga talaga. Okay, so B, bag technique is the tool using a PHN bag through which the nurse during his or her home visit could perform the nursing procedures with ease and deftness. So if that is the case, you will be saving time and effort, no, in rendering an effective nursing care. So this is under the ang tawag mo ito, PHB rationale under Miss Araceli Maglaya's book. Okay, so you might want to read that. Bakit na sikat si Miss Araceli Maglaya? Kasi karamihan ng question sa kanya nang gagaling, no? Sa book niya, okay? When it comes to the board exams, they make use of Maglaya's what do you call this? Book. Yan. Kahit na yung old. If you are using the old Maglaya book, that is also helpful. Meron na kasi siyang bagong version, okay? Nag-upgrade siya. But nevertheless, most of the contents that you will see naman in her new book, newly published books are also shown or yes, are present also in the previous book that she did publish. Okay? So that's number 16. Number 17, which of the following is important in the use of bag technique during visits? Okay, which of the following is important in the use of bag technique during home visit? Is it the arrangement of the contents? It should contain the necessary supplies. It should be thoroughly cleaned. Or it should minimize, if not totally prevent, the infection.
Minimize. Ayan na
Okay,
siguro.
what is your answer? Yes, Mr. Abad.
Baka yan na yung minimize, ma'am.
Okay, very good. Letter D, minimize if not totally prevent the spread of infection. The first two statements, ladies and gentlemen, are first three statements are special considerations only when you are observing your bag technique. But when it comes to the totality of its importance as to why you are performing it, and whenever you perform it, the correct answer would be letter D. You minimize the spread of infection. Or if you cannot totally prevent it, at least you minimize it. So these are the different principles of bag technique. Number 1, should minimize if not totally prevent the infection. That's the very first principle that was identified from our source. It should save time and effort in the it should not overshadow the concern for client, but should show effectiveness of the total care. And it could be performed in a variety of ways and settings for as long as the principles of minimizing the transfer of infection is carried out. Yung tatlo dyan, again, those are special considerations only. But also, kahit special considerations lang yan, you have to observe this also whenever you do perform your bag technique and whenever you do your home visits. Next, number 18. This is an important procedure of the nurse during home visit. Take note of the term, of the words. Procedure ang sinabi. Ang sumagot ng ABC, hindi ko alam kung bakit. Okay? So if it's procedure, it's pertaining to the hand washing. Okay? So hand washing po ang sagot sa number 18. Number 19, in consideration of the steps in applying the bag technique, which side of the paper lining is considered clean to make a quote-unquote non-contaminated area? Is it the lower lip, the upper lip, the outer surface, or the inside surface, which is considered clean?
Outer.
Outer? Miss Anamong, outer? Are you
Inner.
sure? Outer?
Hilda.
It should be the inner side of di ba pinold nyo yan? Pinold natin yan, tapos nilalagay nyo at the side of the side pocket of your CHN bag. We do not make use of the outer surface. No? We make use of the inside surface at least because we believe that that area is clean. Okay? Hindi siya exposed sa external environment. Therefore, we can at least say that there is a minimal exposure to the pathogenic organisms or substances surrounding your bag and you. Next, so inner po, okay, it's letter D. Number 20, a medical herb that has chrysopanic acid, a fungicide used to treat fungal infections like ringworm and scabies. This is also known as your bayabasan. Bayabas-bayabasan.
Guava.
Sumagot ng guava, ewan ko sa atin. Ano na mga kapatid? What's your answer? Is it ulasimang bato, tsaang gubat, or Acapulco?
Acapulco.
Acapulco ang sagot ni Madam, which is the correct answer. Okay? For ulasimang bato, okay? For ulasimang bato, this is responsible for lowering, the uric acid levels of a client with gout and rheumatism. Okay? Your guava is effective as what? An antiseptic, correct? And for diarrhea. And letter C, tsaang gubat or your retusa, is used to treat stomach ache. So it will help you be relieved from stomach ache. So the best answer for that fungicide property is your Acapulco. Okay, so that is number 20. Hindi pwedeng hindi nyo to alam. Because part and parcel of community health nursing is acknowledging and knowing the different herbal plants, okay, the different herbs that can help alleviate or eliminate specific infections or skin irritation or medical related sign and symptom. So you should know these herbs, no? That's number 20, Acapulco. Next, number 21. Niyog-niyogan is commonly given to children above 4 years. Above 4 years old as anti-helminthic. So when you say anti-helminthic, it has a deworming property. Which part of the medicinal plant will you prepare to be taken 2 hours before supper? Parang yung mga anti-helminthic medications din natin, usually take them at bedtime. Okay? So for this niyog-niyogan, the same principle will apply. You have to take it 2 hours at least after supper. So before bedtime pa rin naman yan. Not unless nauna ang bedtime, later ang supper. Oh, so what part of your niyog-niyogan is given to these children, which will act as an anti-helminthic medication? Is it the leaves, the stem, the flowers, or the seeds?
Seeds.
Seeds, very good. So seeds are given to these children, no? Above 4 years of age, prior to bedtime. Okay, after supper, at least 2 hours after supper. But there are considerations, no? When you take in the seeds. Make sure that the seeds that you will harvest, no, from this plant, okay, from this shrub po ata ito. Hindi ko sure. Hindi ako familiar kay nyug-nyugan. Pero the seeds that you will be harvesting, no, from this particular plant, from this particular herb, should be mature, okay, mature seeds. And they should be dried, okay? Again, they should be mature and it should be dried. So it is taken by mouth, okay? So that is your niyog-niyogan. How many seeds will we be giving to our clients? So if you are a child, so 4 years above, let's say marami kasing above. For 7 to 12 years old, so above 4 until 12 years of age, we can give at least 6 to 7 matured dried seeds per orem. Again, 6 to 7 matured and dried seeds per orem. For adults, we can give them 8 to 10, at least, no? 8 to 10 dried, matured seeds of niyog-niyogan 2 hours prior to bedtime. 2 hours after dinner. Yan. So again, 7 to 12, above 4 years of age, 4 years to 12 years of age, 6 to 7 seeds, and for adults, 8 to 10 seeds. 8 to 10 seeds. Ayan. What if, let's say, what if there were no worms that were expelled? Okay, can we repeat the procedure? Can we give them another set of nyug-nyogan? Example lang na you really suspect your child or your family member to be suffering from helminthic infection. Yes, you can do that again. So it may be repeated after a week. Okay? Kung ginawa mo at wala pa ring effect and wala ka pa rin nakikita, let's say for example, a matured ascaris, okay? Matured ascaris, for example. By the way, the most common nematode infection, no, from that we can experience is your ascariasis. This is caused by your Ascaris lumbricoides. Okay, we are talking about human ascaris, Ascaris lumbricoides. So if there are none, okay, and still you suspect your family member na experiencing this helminthic infection, then you can seek consultation to your healthcare provider kung sino man siya. Yan. Next, bakit meron akong mga notes dito? Wait lang. Nematodes. Okay, next, number 22. Chaang gubat is a shrub with small, shiny, nice-looking leaves that grows in wild, uncultivated areas and forests. This herb is known as a remedy for which ailment? So, chaang gubat daw po. Chaang gubat. So, what is the best answer for chaang gubat? It can relieve you from which ailment? Alpha. Very good. Alpha, diarrhea, and stomach ache. So, with this chaang gubat, it can actually act also as an antispasmodic, okay? An antispasmodic effect, okay? So this is, aside from an antispasmodic effect, it is also effective in reducing abdominal pain. Of course, kung may antispasmodic property yan, then you would expect that there is also a relief from abdominal pain. So again, for chaang gubat, it is known for its remedy in addressing these ailments, diarrhea, and stomach ache. What about for B, C, and D? For anti-edema and anti-urolithiasis or stone formation, no? This is anti-stone. It has an anti-stone formation, kidney stone formation to be more exact. Okay? Anti-edema and anti-urolithiasis effect. Sambong po yung isa. Okay? Yung medication natin, sambong. Naririnig niyo si Gwen? Sir Brando? Yan, ang lakas ng tawa niya. Okay, so anti-edema and anti-urolithiasis, that is your sambong. And letter C, rheumatism and swollen gums. It is relieved by yerba buena. Okay, yerba buena. And letter D, asthma, cough, and fever. Meron na rin itong pharmaceutical preparation. You have your lagundi. Okay, lagundi. Yan. So that is for number 22. Next, number 23. The nurse is bathing a patient and notices movement in the patient's hair. So most probably, you could conclude na your patient has lice infestation. Okay, meron tayong pediculosis. Okay, the nurse should, what will you do? A, B, C, or D? Ignore. Use gloves or tongue blade to inspect the hair. Tongue blade, you're pertaining to your tongue depressor, yung wooden. Examine the hair without gloves to make picking lice easier. Taray. And shave the hair off the patient's head, which is the best intervention that you could do.
Dog.
Huh?
Hey.
Was?
Boy.
Boy. They do not shave the hair. Okay? Do not shave the hair of the patient, said, oh my gulay. Idedemanda tayo ng mga magulang. Ayan. So, pero you know what? I have witnessed my father before. Of course, I was young then. Putting gasoline on the hair of my cousin, no? Because he has he talaga. Ang kapal ng hair niya, and there is plenty or enormous amounts of lice, okay? Head louse, tapos yung mga, nicks, yan, doon sa ulo niya. Pero ngayon ko lang na-realize, hindi naman ngayon lang, na it's not proper for you to do that, okay? Because that is very toxic, no? And of course, considering it that is highly, it invites flames. It can easily invite flames. Pwede na natin sunugin yung ulo ng pinsan ko sana, pero hindi naman niya ginawa. Shaving, we don't do that. Not unless, of course, the parent consented na sige pa, papakalbo ko na lang siya. Okay? I guess that is the best sana, no? That we can do. But if you're in the community, kagalang-galang tayo, dapat therapeutic pa rin ang approach natin. Therefore, professionally speaking, you make use of gloves and or tongue blade to inspect the hair of the patient. Okay? So that if you would confirm that there is really presence of lice sa patient's head mo, then you might want to recommend hygienic treatment. Okay? Recommend the anti-louse treatment. Ano ba yung mga common na anti-louse natin?
Using a monkey, no?
Ha?
Lice.
Hindi ko alam yun. Ano yan?
Like in the province, they use a monkey to... They put a
monkey!
Yes.
Ano ba yan? Oo, sige. Push natin yan. Pero, yes, you see monkeys, so they do that. They do that. Totoo naman yan. Pero that is not an intervention that we could employ, no, as nurses. So we usually encourage the use of anti-louse shampoo. Ano yung mga yon? Quell ba is anti-head louse? Marami naman ng preparations, no? Kahit sa mga grocery stores, you can see these preparations being sold in the market. So pwede mo naman gamitin. There are specific instructions written there. You just have to follow it. Kung hindi makabasa naman si community mother, pwedeng i-explain natin sa kanya. Okay? So that they will start managing now the problem sa head louse ng kanilang mga anak. Okay. Sa shaving hair off from the affected areas, okay, is a treatment for pediculosis pubis.
Expenses.
Okay, saan yun? Pediculosis pubis.
Pubic area.
Okay, in the pubic area. So kung may fiesta ng crab lice in that area, then shaving the hair will be of great help. Ayan. Kung may mga crab louse dyan, huwag niyong alagaan. Kailangan natin silang alisin. So these are parasites. Okay? Next, number 24. The responsibility and function of the CHN are focused mainly on the following except saan dyan? If you are a community health nurse, these are all your functions except case finding. Case finding is your responsibility. Okay? Prevention. It's still part of your nursing responsibility being the CHN. Between C and D, which is the best answer?
Except.
Between C and D, supportive or therapeutic? So the correct answer, my dear classmates, is delta. Okay? Therapeutic management. Because when you talk about therapeutic management, these are interventions that are usually ordered by the attending physician. Okay? So pwedeng medication, this could be diagnostic examinations or procedures, and other medical treatments. Dito sa supportive care kasi, we are more focused also in the comfort care and management of symptoms. Okay? Management of symptoms. But for therapeutic, kasama po dito ang order ng ating physician, particularly when it comes to the medication, diagnostics, rehabilitative interventions that falls under DENTA. Okay? So that is not part of our responsibility in the community. Okay? Hindi naman tayo ang nagpe-prescribe ng mga gamot or diagnostic examinations. Okay? Next, number 25. The nurse is providing a diabetic diet teaching to a Hispanic man and his wife. When the nurse is discussing foods that are acceptable, the wife continues to interrupt and make statements like, "Oh, he doesn't eat that," or "all he eats is rice and beans." What should the nurse do? Pakialamera itong wife. Okay? Dami niyang sinasabi. So what will you do as the nurse if she keeps on interrupting you, especially in giving the dietary instructions, no, to this diabetic client who is of Hispanic origin? What is the letter?
Letter 8 answer ko.
Letter A, ask the wife to leave. Okay, very practical. Okay, napaka-kwan naman natin masyado. Hindi naman sa kaya lang medyo this is not the proper way sana, no, to address the problem. Practically speaking, kung paalisin ko daw, umalis ka na nga, parang ganun, wala ka namang naitutulong, but that is not supposed to be. Okay? So what is the best answer that you can offer? Explain how rice and delta, very good. You can refer the patient and his wife to a dietitian who is familiar with the Spanish food choices. Okay? Baka doon mas maiintindihan ni wifey, okay, the importance of subjecting our patient to a proper diabetic diet. Okay? Yan. So 25 is delta. This is part of your collaborative role, no? Referring our patients to other members of the healthcare team who can address the problem. And in this case, we need the help of our dietitian. Next, number 26. The patient says, "You are the worst nurse I have ever had." Ganun ba yun? Hindi kaya? Diba? May exclamatory point yan. Which response by the nurse is the most assertive? Assertive. If I were you, I'd be grateful for a nurse like me. Taray. I feel uncomfortable, sorry. I feel uncomfortable hearing that statement. How can you say that when I have been checking on you regularly? You shouldn't say things like that. That is not right. What is the best answer? Assertive, hindi ka naman bastos.
I feel.
Okay? At least, choose letter
B.
D. Bravo. Okay? I feel uncomfortable hearing that statement. Okay? So that is number 26. Number 26. But parang nawawala ako sa page ko. Wait lang. Yan. So, being an assertive nurse, sometimes, no, it can help you out especially when your patient's way of communication is non-therapeutic. Okay, medyo may pagka ano na siya, bastos. I do not know how would you describe that, but of course we have to consider also the current situation that the client is in. Tignan mo rin, you have to weigh things out on how you would probably address the statement of your patient. Next, number 27. A patient is admitted to a rehabilitation facility following a stroke. The patient has right-sided paralysis and is unable to speak. The patient will be receiving physical therapy and speech therapy. What are these examples of? Is it a primary prevention, secondary, tertiary, or health promotion? Charlie, very good. Okay, your health promotion, okay? Health promotion. The correct answer here is letter C, tertiary prevention. Why? Tertiary prevention is already concerned to the improvement, okay? To the improvement of the patient's condition related now to its treatment and faster recovery. The tertiary prevention is usually encouraged when a defect or disability that is permanent or irreversible is evident. It involves minimizing the effects of long-term disease or disability through interventions directed at preventing complications and further deterioration. So yan po ang ating tertiary prevention. So that is the correct answer. So since the patient has had a stroke and there are evidences already of the stroke, no, meron na siyang right-sided paralysis, meron na siyang problema sa speech, and he is to undergo Okay, pasensya na sa abala. Ayan. So that is for the tertiary prevention. Kailan mo masasabi na may secondary and primary prevention? So by the way, these are the 3 levels of health promotion. We have primary, secondary, and tertiary prevention. Your secondary prevention will focus on individuals who are experiencing health problems and illnesses and who are at risk of possibly developing complications, okay? Or worsening of condition. Yung primary prevention naman, your primary prevention will include preventive measures that comes before the illness or injury. Okay? Preventive measures. It covers the preventive measures that comes before the illness or injury. So dito, wala ka pang sakit. Okay? Wala ka pang sakit sa primary prevention. All you have to do is to enhance your, to at least practice a healthy lifestyle. Yan, sa mga primary prevention. Dahil wala ka pang sakit, you are more into engaging yourself to healthy activities, physical activities. As to your dietary intake, ayan, na i-consider mo ang mga yan since wala ka pa namang kakaibang nararamdaman. But for tertiary, of course, you already have the evidences of specific diseases that could possibly be debilitating and would cause deterioration on the part of the patient. So that is number 27. Okay, number 28. The community health nurse in one of her home visits is assessing how a patient's pain is affecting mobility. Which assessment question is most appropriate? Okay. The nurse is assessing how a patient's pain is affecting mobility. Which among the following question is most appropriate?
No.
Bravo, very good. What activities? Kasi nga, mobility ang pinag-uusapan natin, pain and mobility. What activities, if any, has your pain prevented you from doing? So because the nurse is interested in knowing whether the patient's pain is affecting mobility, this will be the priority assessment question to ask. How the pain affects his or her ability to participate in the normal activities of her daily living. Okay? May ano ba to? Letter A. Although a physical therapist nakalagay dyan, have you considered working with a physical therapist? Yes, this may be applicable, but as of the moment, it doesn't address the problem on pain. Okay? So, kaya disregarded po yan as the best answer. Okay. The quality of pain or assessing the quality of pain and the effectiveness of pain medication does not help the nurse understand how. Okay, the word there is how it is affecting the patient's mobility. Okay, so the best answer still is your letter B. Okay, number 29. The initial step in the planning process in order to engage in any nursing project or activities in the community level is A. Ano ang tamang sagot? 29. The best answer is assessment. Assessment.
Alpha.
Alpha, very good. So ang keywords mo kasi dito, the initial step in the planning process. Therefore, you have to disregard the assessment and assessment activities. Okay? So, ano ang magiging sagot natin? It will be the goal setting. Okay? So, initial step in the planning process is the goal setting. Okay? So, you have to establish your priorities and write your goals and outcomes in order to develop an evaluative strategy. So that is the first activity that you should do when you are in the planning process. Next, number 30. The nurse is collaborating with the dietitian about a patient with a stage 3 pressure ulcer. After the collaboration, the nurse orders a meal plan that includes increased protein, vitamin A, carbohydrates, or vitamin E. Okay, before you go with the answer, let us just first define or describe how a stage 3 pressure ulcer would look like. So in this case, some of the skin, the surrounding skin or the surrounding tissues may be damaged, beyond repair. Hindi na siya pwedeng i-repair. Medyo mahihirapan tayo, as to the healing process. Why? Because there is already the involvement of full thickness skin loss. That can possibly extend or that extends to the subcutaneous layers, forming a small crater. So the subcutaneous layer has been damaged. Pwede rin necrotic na siya. So that is for stage 3. Ma'am, wala bang muscles involved? Wala bang bones? Hindi po yun classified as stage 3. So when the pressure ulcer would enlarge and create a big hole on that particular body part of the patient, that it will be classified as stage 4. Pag may involvement na ang muscles, tendons, and even possibly the bones. Yung iba kasi nakikita mo na yung bony prominences nila if they are classified as stage 4 pressure ulcers, but not for stage 3. So in this case, which is the most important part of the diet. What major food element is very important in this area? It will be
Charlie.
fats. Okay, letter C, protein. Okay, protein, because in wound healing, it does not require an increased amount of fats and carbohydrates. Okay, and still for vitamin E, it is not yet known, no, to contribute now to the wound healing or the healing process. Wala pang studies about it. So the very close answer, or the best answer that you could give is still protein, because of its ability to support now the activities of wound repair. Okay, so that's number 30. 31, which of the following is an advantage of home care? Home care. What is the advantage of home care? Before we proceed, who are good candidates for home care? Okay, the elderlies, the older age groups, yes. Who else? Those who are chronically ill, recovering from surgery, disabled, yan. You can actually subject them, no, to home care. Okay, home care. Pag sinabi mong home care, my dear classmates, we do provide supportive care, no? The care that is supposed to be provided by a professional caregiver in the patient's home. So ito, in the patient's home or in-home care. In-home, in-home. Okay, so we do not, pag sinabing home care, hindi po ito yung sa my nursing homes, hindi po. Or ano pa yung mga ibang hospice care, hindi. Pag sinabi natin na home care, sa bahay mismo ng pasyente. Okay, that is attended by a professional caregiver. So which is the advantage, or which among the following is an advantage? Is it A, B, C, or D? What is your best answer? It disrupts the family interaction. Ay, sorry. Asa na ba ako? Greater risk of infection since houses are not as clean as hospitals. It allows families to be kept intact during chronic illnesses. No technical monitoring equipment can be carried out at home. Home care is more expensive than hospital care. Eliminate 2. Let us eliminate 2. Greater risk of infection since houses are not as clean as hospitals. Tatanggalin ba yan? Hindi. Tanggalin. Home care is more expensive, of course. I don't think so that is more expensive. Not unless yun ang tingin ninyo. Tatanggalin? Hindi. Tanggalin. Between B and C, what is the best answer? Home care.
Bravo!
Bravo, very good. It allows the family to be kept intact during chronic illnesses. Okay, so that is one of the advantage of home care. So home care is ideal also for patients with chronic illnesses, especially of what age group? What age group? Alam nyo na yung extremes? We have the elderly. Wala naman dyan. Neonates, masyadong bata. Charot. Oo, neonates kasama. Pero you have to consider that pag neonates kasi 28 up to 28 days lang or 29 days old. 29 days old. Paano naman yung pang 30? Paano yung pang 2 months? Okay? So you have to bracket it. Isama natin itong letter D. Greater than the age of a neonate, we will choose letter D as the best answer for home care. Okay, ideal patients for home care. Okay, considering that they have chronic illnesses. So the best answer that you could give here is bravo. Okay, that's number 32. Next, number 33, which statement is true about the disadvantage? Okay, let's talk about the disadvantage. Kung may advantage, may disadvantage. A, B, C, or D? It provides an opportunity for one-on-one health teaching. Is this a disadvantage or advantage?
Advantage.
Advantage. It does disrupt the family interaction. It does not. Okay? It does not disrupt. Home care does not disrupt family interaction. Rather, it's the other way around. Okay? Next, letter C. It can be exhausting, especially if care is mainly delegated to a single person.
Yes.
Yes. Okay, so that is the answer. Sa letter D kasi, it is still an advantage. Ay, letter C, letter D, I'm sorry. It's still an advantage of home care. But the disadvantage is that sometimes, no, if you are the one who has knowledge on caring for this specific person, lalo na if you are medically inclined, tayo yung parang abused people, no? Joke lang. Parang mas inaasa nila sa atin yung care ng significant others natin if they are critically ill or chronically ill. Babalik-balik sa hospital and then you decide to stay at home, tayo yung mas madalas napapagod. But of course, kaya tayo nagkakaroon ng diagnosis na caregiver role strain. Okay? Caregiver role strain because of these ones. Okay? So, yan po. That's number 33. Next, number 34. Who among the following is the best candidate for home care? Best candidate for home care.
Delta.
Delta. Any other?
Alpha.
Okay, so those who are recovering from surgery are also the best candidates for home care. For acute illnesses, pneumonia, and those requiring critical care, we need the attention and the help of our physicians. Okay, we need the help of the physicians. Okay, that's number 34. Is post-surgical client. Next, number 35. Who among the following clients is home visit recommended? Naku, nasagot na rin natin to. Pero sige, A, B, C, or D? It's the terminally ill. Okay? Terminally ill client. Asa na tayo? Number 35. Okay, next. Situation 36 to 40. You are to conduct a home visit for a client. Okay? For a client referred, Jeddah, a public health nurse, plans to conduct a home visit for a client referred to her during their regular office hours in the health center. Her patient is Donita, a 45-year-old female who gave birth to her 15th child via cesarean section. In preparation for her first home visit, Jeddah is correct when she performs the following exit. Okay. In number 36, what could be the option, no? That is not supposed to be performed by Jeddah? Obtain a copy of Donita's referral form. Is this not supposed to happen, being the healthcare worker in the area? Do you need a copy of her referral form or discharge forms? Kasi nga may referred dyan. The client is referred to you during the regular office hours. Pang 15th na niyang delivery ito. Cesarean section. Are you supposed to have a copy of the referral form? Community health nurse ka.
Yes.
Yes, okay. You should have a copy. Okay, kasi ni-refer nga sa'yo. Okay, letter B, obtain needed supplies. Is this a do or a don't?
Do.
Do. Okay, you have to obtain the needed supplies. Keep in mind to respect Donita and her family's privacy, beliefs, lifestyle, and request. Is this true or false?
True.
True. Okay, text Donita that she will be visiting her. This is pertaining to Jeddah, no? Jeddah should text Donita that she will be visiting her.
No.
Okay, sabi ni Mr. Abad, no. Let's see letter E. Visit Donita during lunchtime
Ay,
since she is most probably home.
E pala
No.
yun. No.
No.
Okay.
Yes, yung B.
Okay. So as part of your courtesy call, or let's say yes, part of your responsibility is to inform the client na, Madam, bisitahin po kita or dadalaw po ako by 10 a.m. Okay? So I'll see you later. So it's but just proper for you to inform her of the visit rather than going to the area tapos thinking that she is there. Eh paano kung wala? Pumunta siya sa kanyang grandparents. Eh di naloka ka. What kind of reasoning is that? She is most probably at home. Okay? So letter E is eliminated. So do not assume. You have to text her beforehand so that at least you know if she is there or not. So that if she's not around, you can probably reschedule the visit when she is available. Next, number 37. Donita's mother, ito laging tanong ito. Donita's mother offers Jeddah with food every time she visits, but Jeddah prefers not to eat there. Jeddah's best approach would be, anong magandang approach nyo? Tell Donita's mother that it is against their agency policy to accept food. Okay, you have to choose what is best. Ask Donita's mother why she feels the need to feed her every time. Tell Donita's mother that you cannot eat there because their house isn't clean. Napaka-disrespectful mo naman, Madam. Aning, Jeddah would pack a lunch and bring it with her every time she visits. Oh, the statement. The mother is offering Jeddah food every time she visits. So whether may pack lunch siya o wala, magbibigay pa rin si mother. Very good. Okay, yan naman yung isa sa pinaka-common na tanong sa inyo. Okay lang naman na tanggapin natin, no? Sana yung one, pero I do not know. In the area kasi, have you experienced this? Have you experienced this one? Na pinipilit kayong tanggapin yung food? Minsan binubulsa na lang kahit na sabi mong pulburon yun.
Yes, ma'am. Gusto ko ah.
Oh, si Mr. Abad gustong-gusto niya. Pero
Kasi
actually,
magagalit din sila, ma'am.
sa ethics kasi, sa ethics mo kasi, madam and sirs, no, it is not supposed to happen, no, that we keep on accepting food coming from our patients. But here in the Cordillera kasi, no, with due respect to our culture, there are some individuals who offer us food and they would feel bad if you will not accept it. Tama?
Yes, ma'am. Sa bayan niyo, ma'am.
Yes. Sa bayan namin? Saan yun?
Grabe
Grabe naman si Mr.
Di ba
Abad.
kasyayan niyo, ma'am?
Ha?
Di ba kasyayan niyo?
Kaya
Kasi, ganun talaga because of their culture. Kaya lang, sometimes if you cannot get away with it talaga, that they insist, no, to give the food or anything that you can bring home, ano yung ginagawa natin? Disregarding now the scenario here, no? Dito kasi we have to tell, ma'am, kasi ganito po, hindi naman sa ayaw ko, ganun. But one of our agency's policy is not to accept food, blah blah, sasabihin natin sa ating mga patient or client in the community. But sometimes, ano yung ginagawa natin, mga kapatid, yung totoo lang. What is the practice that we usually do or we see in order not to offend the individual who is offering food?
Tanggapin.
Tinatanggap pa rin natin, but we do not eat in front of them. Diba? Parang tinatago muna natin. Yes, I will just keep it, thank you, tapos kakainin mo na lang pagka-uwi. Ganon. But yun nga, it is still against our policy, no? The agency's policy to accept food or anything from our client. Part of your ethical considerations ito. But sa culture, sige, bigyan natin ng hustisya yan. Sa kulturang Pilipino, lalo na sa atin here in the Cordilleras, hindi mahirap yung tumanggi minsan, no? Kasi feeling nila ayaw mong tanggapin. They would really feel bad when you don't accept their offer. Next, number 38. Kaya pag sa community, ang saya-saya sa community pag immersion. Okay, number 38, hindi dahil may mga libreng pakain. Okay? Next, number 38. Donita will be taking medicines around the clock, which is a good safety measure to teach her about taking medicines at home. Medicines around the clock, which is a good safety measure that you could teach her about taking medicines at home.
Delta.
Delta, very good. Never take the medicines in the dark to ensure type and dosage. Ay ang rationale. To ensure type and dosage. Bakit ka nga naman iinom ng gamot sa kadiliman? Okay, you are not supposed to crush pills, no? For easy swallowing to avoid aspiration. Sometimes there are medications that do not require crushing, okay? Because you are already destroying the integrity of the medicine. Ayan. Take all medicines with meals to ensure good digestion. Yes, these are some things that you could consider, but since we are talking about safety, the best answer is never take the medicines in the dark. Okay? Yan. Next, number 39. During the final stage of Jedah's visit, which of the following would be the expected activity? So what will you do? Tapos na ang home visit mo. What are the things that you should do? First, you document all the information gained from the visit in relation to the client's condition. Okay? Assess the client's needs. Tama ba ito?
Yes, ma'am. So next time.
Okay. Next time. Ang question, my dear, is the home visit is done. Okay? So assessing the client's needs is not part and parcel of the final stage of your home visit. Okay? The assessment happens initially. Okay? The very first time that you have had an encounter with the client or with the patient. So we disregard letter B. Okay? So letter A is accepted. You have to document everything that you have done. Letter B, assessment. That is the first thing that you usually do, which is not part of the final stage already. Letter C, evaluate the client's current status and future needs. Is this true or false? Evaluation of the client's current status.
True.
True, okay. Letter D, you plan for the schedule of the next visit. Is this true?
True.
True.
Okay, and plans on what she will bring for today's visit. Tapos na ang visit. Okay, so letter E is eliminated. Bakit ngayon ka lang magpa-plan? Tapos na yung visit mo. Okay, so letters A, C, and D are the correct answers. Okay, tapusin lang natin ito mga kapatid. 40, which of the following is one of the major functions of home health nurse? One of the major functions of a home health nurse. Number 40.
Major home health nurse.
Health promotion, primary prevention. So as a home health nurse, since wala naman tayong mga, anong tawag mo dito? Therapeutic interventions that we usually do apart from supportive care and may isang ibagakatan. Supportive care and symptomatic care. The very best answer that you could do or that you could provide
Teaching.
being a home health nurse is letter Bravo. Okay? Provide health teaching. Very basic, diba? As a home health nurse. Next, number 41. When teaching a client about cervical mucus o contraceptive, sino yung mga gumagamit sa inyo ng family planning method? Natural family planning method. When teaching a client about the cervical mucus contraceptive method, the PHN who is assigned to the family planning clinic should instruct her to avoid sexual intercourse when her cervical mucus is cloudy and thick, clear and thick, cloudy and elastic, clear and elastic. Okay, cervical mucus ito. Cervical mucus contraceptive method. So what is the best answer?
Delta.
41 is delta. clear and elastic. So if your vaginal secretions using the cervical mucus contraceptive method is clear and elastic, you abstain from sexual intercourse, okay? Because this is an indication that you are ovulating. Ayan. So kung nag-ovulate ka, naku, very high ang chances na mabubuntis ka. Okay,
Grace.
so,
Oh,
ha?
Calvin.
Grace. Ate,
O Miss Grace, hindi bali kay Miss Grace kasi mukhang ina-anticipate naman talaga yata niya na magbubuntis siya. So at least you know that if your vaginal secretions are clear and elastic, ayan, nag-ovulate ka. Kaya kung gusto mong magkaanak, go. But if you are using the cervical mucus as a contraception, yes, as a contraceptive or as a family planning method for you, then please abstain from sexual contact if you do not want to get impregnated. For the pre-ovulatory, no? Pre-ovulatory, so wala pa. And post-ovulatory phases, tapos na of your menstrual cycle. Usually, your cervical mucus is cloudy, thick, and inelastic. How would you assess the elasticity of your cervical mucus? Of course, you have to get a sample from your cervical mucus and test if it is really elastic. Okay, pag elastic kasi yan, naku, bongga ka. Okay, yan, you are a candidate for possible pregnancy. Okay, so yan, you try to abstain. Yes. Ano po?
Ma'am, ni Calvin, panunod na data.
Okay. Hindi ako aware na meron pala siyang clear and elastic secretions. Okay?
Ma'am, cloudy ngayon.
Cloudy, in fairness.
Pwede pa.
mausok ka.
Safe na safe ka.
Oh.
Oh, yes. Next, 43. Yan, you congratulate yourselves. Next, 43, a patient who has taken an oral contraceptive for the past 3 years asked the nurse how long she would wait before attempting to become pregnant. O yung may mga gumagamit sa atin ng oral pills or oral contraceptive, should I say, what advice will you give to them if they wanted to get impregnated? After, she can try to conceive immediately. Wow, stop mo ngayon, bukas buntis ka na. Ganun ba yun? Okay. Or after a week, you're pregnant. She should wait at least 1 month, 3 months, or 6 months. Which is the best answer that you could give? Ay, sorry, 43? Hindi pa pala tayo tapos sa 42. Anyway, sagutin muna natin si 43. She should at least wait 5 months, wala sa choice.
3.
3, ma'am.
3. Okay, so letter C. The patient should at least wait for 3 months before attempting to conceive. Why? At least with that time frame, you can provide sufficient time for your estrogen and progesterone levels to return to normal. Okay? Sa bagay, ito, case-to-case basis kasi. Kasi I have known of a friend no, na she has been using oral contraceptives. Medyo natagalan talaga. Inabot sila ng 1 year, more than a year. So it's a case-to-case basis. Pero based on our book, okay, you can actually instruct the client to at least wait for 3 months, okay, before the return of the estrogen and progesterone levels to normal. Ayan. So pwede na siyang magbuntis after 3 months. Maghintay na lang siya. Okay? Huwag siyang mag-imagine na meron siyang partner. Dapat may partner ito. Ha? At least 3 months kung kulang tapos single yung kausap mo. Okay? Next, number 42. Balikan nga natin yung 42. Sorry. Nalagpasan natin. Which contraceptive method does not provide protection ito pa na, against sexually transmitted diseases?
AUD.
Wait lang. Number 42 is letter. Ano yung IUD? Letter C. Yan. An IUD, okay, why IUD? An IUD provides no protection against STI since it's not a barrier. Okay? It is not a barrier contraceptive. For A, B, and D, you have your latex, diaphragm, and spermicide. Taray, sinong nakasubok nito? Diaphragm with spermicides. Cervical caps with spermicides. Okay? Mamamatay naman talaga yung sperm mo dito pag may spermicide ka. These are examples of mechanical barrier contraceptive methods that provides even better protection against STIs when used with spermicide. So together with ito diaphragm plus spermicide, cervical caps plus spermicide. Hindi ako familiar sa female condom. Have you seen one? Ako hindi, honestly. Okay? Latex condom, oo. Pero for female condoms, have you seen one? May philosophy naman tingin ka sa Lazada. Yung mga mahilig mag-Lazada dyan, huwag niyong i-advise sa akin yun. Di ba? Baka meron doon. No, kasi these things are being advertised in this online shopping networks. Ewan ko ba? Pero anyway, hindi pa talaga ako nakakita ng female condom. Okay, yun lang. Okay, next. Number 40, anong number tayo? 44. Miss D. Mrs. D, age 24, has been taking oral contraceptives for 3 months following the birth of her second son. She reports to the clinic nurse that she feels bloated and that her rings and shoes feel tight. The nurse should instruct Mrs. D to discontinue the oral contraceptive and call the physician immediately if she experiences what? Hypomenorrhea, decrease, dysmenorrhea, pain, severe headaches, and leukorrhea. This has something to do with your vaginal discharges. So which among the symptoms, okay, or the signs that you could instruct your patient na pag ito meron ka, you should call your physician or go to the nearest healthcare facility? Which among the symptoms, signs and symptoms presented? Letter C, severe headache. Why severe headache? Okay, so this could be an early indication of hypertension. The increase in blood pressure is usually an adverse effect of most oral contraceptives. Okay, this is also usually attributed to the increased incidence of CVAs. Ano ang CVAs? Cardiovascular or cerebral? Cerebrovascular accident. Okay, so very good. Your oral contraceptive typically decreases hypomenorrhea, dysmenorrhea, and leukorrhea. So aside from severe headaches, which could be an early sign of hypertension, there are other indications that you could tell also your patient, which is not here naman, to discontinue the use of oral contraceptives or your OCPs if there is persistence of abdominal pain, chest pains, eye problems, and severe leg cramps. Ang masaklap kasi kay Madam, nagkaroon na siya ng feeling of bloatedness, and of course, yung isa, her rings and shoes feel tight. Okay, so these are warning signs already. Okay, so if there is persistence of this condition with severe headaches, you tell her to consult her obstetrician already. Or kung hindi man, you go to the nearest healthcare facility. Number 45, Mrs. D asked the nurse what she should do if she forgets to take her oral contraceptive. Board exam pa rin ang mga to. Tablet for 2 days. What will you do? You discard all the tablets ba? Mag-double dose ba tayo? Immediately after realizing? Yes, what's your answer in number 45? B. Discard the tablets in her medication packet and use another contraceptive method.
A, ma'am.
Okay, sabi na ni Madam naman na isa, disregard the forgotten tablet, take 1 tablet.
Yes.
Of the rest.
Delta.
C.
Delta, take 2 tablets for the next 2 days. And use another method of birth control.
Letter C.
Bravo.
Okay, so the correct answer, ladies and gentlemen, in number 45 is Charlie. Immediately, pang second day mo pa lang yan, no? 2 days na. You immediately take the forgotten tablet plus the tablet scheduled for the day. So, pwedeng ma-double dose mo yan. Pero, pag nag-third day ka na, fourth day, saka mo na-realize na, oh my goodness, I forgot to take my OCPs, then you stop and use another form of contraceptive because there is already a gap, no? A great gap between the days that you should have been taking the oral contraceptive pill. Okay, kung nakalimutan mo kahapon, okay na. Ngayon, bigla mong, naalala ko, nakalimutan ko yung pills ko. O, dalawa agad ang iinumin mo. Okay? Huwag kang mag-panic, safe ka pa. Pero, if you miss it on the third day, fourth day, fifth day, na stop the OCP, it will not help you. It will put you a greater chance already of possibly getting pregnant anytime soon. Ayan. So yung kaya nga ang OCPs, it is advisable for those people na hindi makakalimutin. Kung masyado kang makakalimutin naman at you are still in your reproductive ages, no, you might want to consider the use of implants. Okay, implants. Family planning implants. Yun yung nilalagay natin sa upper inner forearm. Forearm, tama. Upper arm. Sorry. Ayan. So dito, implant. So sino pong nakasubok sa inyo na magpalagay ng implant as far as a family planning method? Wala. Injectables. O meron na po yung monthly. And meron na rin po yung every 3 months. Okay? Ang pinakamatagal pa rin po is the implant. It can offer you at least 3 years protection. No, 3 years protection. But for those who are receiving the injectables, that's fine. Meron na po yung monthly, meron din naman po yung every 3 months. Ewan ko kung may every 2 months. Ang alam ko lang yung monthly and yung every 3 months. Okay? Kasi yun ang gamit ko. Yan. Kung makakalimutin ka, never mind using your OCPs. Pag may hypertension ka, please reconsider your OCP. Hindi yan bagay sa'yo. Okay? Considering that this can actually increase one's BP. Okay? Next, number 46, which factor in a woman's health history will contraindicate the use of diaphragm? Okay? So far, hindi pa ako nakaka-assist ng ganito. Insertion, yes, the use of diaphragm as a family planning method. Wala pa akong naya-assist na ganyan. What about you? In the OPD department, outpatient department, or community, RHUs. Nasubukan nyo na bang mag-assist? Hindi pa. Okay, so which factor will contraindicate the use of diaphragm? Is it frequent UTI, depression, hypertension, smoking?
Smoking.
Itong diaphragm, ilalagay natin doon sa baba. Okay? Smoking, it is not a contraindication for oral contraceptives.
Okay.
Okay. The best answer is alpha. Okay? Urinary tract infection. Okay? The use of diaphragm actually as a family planning method increases one's risk to UTI because of the manipulation of the device. Siyempre, papasok mo yan, galaw-galawin mo, okay? And the possibility of introducing bacteria during the insertion and removal. So if you are a client, no, who is frequently experiencing or frequently diagnosed with UTI, diaphragm is not a good family planning method, okay? So you might want to reconsider other methods of contraception but not your diaphragm, okay? Because of the risk of introducing pathogenic organisms as you insert the thing and as you remove it, no? So yan po, diaphragm. Next, number 47, Mrs. Wine, a 27-year-old gravida 3 para 2 2012 has elected to have an IUD. So she decided to have an IUD inserted today in the clinic. Which factor in Mrs. Wine's history indicates that she is a good candidate for IUD? Is it the age, gravidity, parity, or marital status? Gusto kong magpa-IUD. Magpalagay ng IUD. Nakatatlong pagbubuntis na ako. O ako si Mrs. Wine. Based on my score, meron akong history of abortion, correct? I have 2 kids living, correct? I have term pregnancies. Hindi na ako currently buntis. So, what is the best choice here? It will be the parity. Parity, okay? It's letter C, okay? So parity is of great concern, no, when it comes to the scenario. Candidate for the insertion of intrauterine device. Analiparus, okay? Client who wishes to become pregnant should not use an IUD because of possible adverse effects after her future fertility. Although the age, gravidity, and marital status are irrelevant, okay? Irrelevant for the suitability of IUD, okay? Pero kung hindi ka naman buntis, naku, pwede naman yan, okay? Ibigay natin sa'yo, ialagay natin basta hindi ka buntis. Pero, IUD, hindi po yan 100% protection, diba? Because there are failures, human error, okay, sa IUD. There are still chances na pwedeng mabuntis yung pasyente, lalo na kung na-dislodge ang intrauterine device. Okay? Meron pa rin failure dyan. Next, number 48. Although its exact mechanism is unknown, the IUD is thought to achieve contraception by inhibiting all of the following functions except IUD, we are talking about exception to the action of IUD. Okay? All of the following are the mechanisms of action of IUD except for one.
C?
Dog, very good. Dog, Mr. Abad, dog, ikaw talaga. Dapat pala ikaw ang lecturean natin dito eh. Charot lang. Okay, so spermatozoa transport is inhibited. No? Siyempre, may IUD, may nakaharang, may gate. Okay? Fertilization will not take place. Paano magkakaroon ng fertilization dyan? Inaharangan na nga yung spermatozoa. Okay, so that is still an action of IUD. Implantation of fertilized ovum, it cannot possibly happen. Wala ngang fertilization because of the gate. Okay, quote unquote. Ovulation can still happen, my dear. Saan ba nanggagaling yung ovum? Sa labas o sa loob?
Side.
It's inside, correct? So, magkakaroon pa rin tayo ng maturity and production of egg cells, matured and immatured egg cells. Okay? Pwede pa rin namang mangyari yan sa katawan ng babae. Hindi yan mapipigilan ni IUD. The things that can only happen if you have this IUD in you is for you to prevent the first three. Okay, the first 3 activities that are mentioned in this question. So, you can prevent spermatozoa transport. Fertilization cannot happen. Hindi nga makakalabas yung matured egg cell kasi may gate. Paano mo pa inimit si sperm cell kung pinagbabawalan ka na ni IUD? Okay, you get the point? So walang mangyayaring fertilization, walang mangyayaring implantation. In short, canceled ang date mo. Okay? Canceled ang date ni egg cell at ni sperm cell because of IUD. Okay? Yan yung istriktong nanay at tatay nyo. Okay, next. Number 49. The nurse explains to Mrs. Wine that she should report certain adverse effects of IUD to her physician, which statement made by Mrs. Wynne would indicate a need for further teaching. The correct answer here, ladies and gentlemen, is letter A. I should expect a delayed menstrual period followed by scanty. Okay, take note of the description, scanty or irregular bleeding. Okay, what does this indicate? Okay, example lang, adverse effects of IUD. Okay, how will you know, no, that there is a problem with your IUD? How will you or what will you be telling your physician? Okay, a delayed menstrual period followed by a scanty or irregular bleeding. Okay, irregular bleeding. Ito yung sinasabi ko sa inyo na hindi 100% ang IUD. A delayed menstrual period followed by a scanty or irregular bleeding on and off may indicate an ectopic pregnancy. So in short, there is a failure, no, with the use of the IUD. Okay, human error yan. It may indicate an ectopic pregnancy, so the client should report this immediately to the attending physician. If there is a severe pelvic or lower abdominal pain, if there is presence of genital sores or lesions, or if your menstrual flow is very heavy that lasts longer than usual, I should contact the clinic, sabi niya. Okay, this may indicate endometritis. Okay, endometritis. Pag may sores or lesions ka naman, it could be possible that there is a partial expulsion. Okay, medyo na-detach, okay, nawala sa placement ang ating intrauterine device, or it could probably be that there is a perforation of your uterus, or you have a pelvic inflammatory disease that needs to be reported immediately because of the dislodgement of the intrauterine device. So the best answer here is number 49. Okay, number 49. Number 49. Now, letter A, sorry. Next, number 50. The nurse tells the client how to determine ovulation. Okay, ovulation using BBP. Do you use this? Okay, when will you know that you are ovulating? Okay, which statement would indicate that the client understands how to interpret your daily basal body temperature? Okay, so how will you know? This is again another natural family planning method. Yung ayaw sa artificial, we have our natural. Meron pa kayong rosary beads. Okay, yung beads, ginagamit natin. This is applicable only, yung mga rosary beads natin, applicable for those individuals with regular menstrual cycle. Regular. Okay? Hindi yung monthly ka na dinadatnan. You are maintaining a cycle like 28-day cycle or 29-day cycle every 29th of the month or 29th day. Ganyan lang yung cycle that is considered to be regular. Pero kung, yes ma'am, regular ako, monthly. Tapos pa-iba-iba yung araw ng menstruation mo, no, yung pagdating ng menstruation mo, then you are considered irregular. So what is your answer for BBP? Okay, the correct answer here, ladies and gentlemen, is letter B. My BBP will drop just before the ovulation and then significantly rise 24 to 72 hours after ovulation. So why is this so? Because typically, ladies and gentlemen, the fertile period begins when the temperature, okay, the fertile period of women begins when the temperature starts to drop, okay, and ends when a temperature returns to normal after rising. So you will have to observe this for at least 24 to 72 hours. Okay? To observe the cyclical patterns, the patient should be monitoring her BBT for at least 3 months before analyzing the results. So you will be observing yourself for 3 months. Lagi mong gagawin yan every now and then. Well, of course, I cannot guarantee you that you will not get pregnant, okay, using this PBT kasi medyo matagal ang observation period mo. So I suggest that if you plan not to get pregnant, please try to, of course, through other family planning method. If you think that PBT will take much of your time monitoring your temperature, okay? Lagi mo yung ginagawa, same time, early in, during your, before you rise up from bed. Okay? Next, that is number 50. Before you rise, sinabi ko na ba? Ayan, to obtain the most accurate reading of BBT, the client should take it when? After, sinabi ko na kanina, immediately after awakening, before arising from bed. So nakahiga ka lang. Wala ka pang activity talaga. Apart from getting the thermometer just located at your bedside o nasa bedside table mo. Wow, social bedside table. Yun lang ang naging activity mo. Other than that, wala na. So you should take your BBT immediately after awakening before rising up from bed. Okay? You will do this for 3 months. Okay? And you will try to observe yourself. Nag-ovulate ba ako o hindi? Or wala talaga. Okay? Huwag ka namang masyadong nega, madam. Meron yan. Okay, 52. Several adolescent girls are discussing sexual activity with the nurse at the sexually transmitted infection clinic. Which comment indicates to the nurse that the client has not understood the teaching regarding safe sexual practices. Okay. Which statement made by the audience, particularly the adolescent girls, that they have not understood the teaching regarding safe sex. 52.
Boy, ma'am.
Boy, very good. I douche after intercourse. Bakit? Sa labas lang ba yung sperm? Nakaka-penetrate na po yan. It is very projectile. Once it has been ejaculated, very projectile po ang mga yan. So douching after the intercourse will not guarantee you not to get pregnant. It is not even, it will not also tell you that it's a safe sex practice. Okay? If you do not want to get impregnated, douching is not your course of action. Okay? Yan, kahit na anong hugas mo dyan, kung nakapasok na yan sa loob, good luck. Okay? So douching does not protect you against any type of infection, against towards getting impregnated. Ayan, hindi ka niyan matutulungan ka ng bongga. Okay, damages the natural protective barrier, your douching. Kung everyday mo yan ginagawa pag douche, kasi pag douching it's not simply washing the outer part, your perineum. Hindi lang ganun. Kailangan pati sa loob. Okay? Nahuhugasan mo yan. Yes, may na-amaze. O talaga, pati sa loob, ma'am, pwede. Oo, pwede. Pwede. Kasi kung ikaw naman yung katawan mo naman yan, you can do the douching properly. Again, yun lang, it will be on the part of the lady, your natural protective barrier could possibly be altered. Baka maging, instead na acidic yan, naging alkaline na. Pag alkaline ang iyong, ang pH ng ating vagina, we are inviting pathogenic microorganisms to multiply in the area. And you do not want that to happen. Okay? Next, number 53. When discussing safe sex, which information about the use of condom would be most helpful? The best answer is latex condom is what? A poor choice of birth control. Hindi naman. They do not interfere with the sensation.
Prevent transmission of germs.
Very good. Prevent transmission of germs. Bravo. Okay. Next, number 54. A 25-year-old wishes to take OCPs When taking her history, which of the following questions would determine if she is an appropriate candidate for this form of birth control? What is the statement that will qualify our 25-year-old girl, a lady, should I say, for OCPs?
Alpha.
Alpha. Do you currently smoke cigarettes? And if so, why? Okay? Bakit? Because cigarette smoking can significantly increase the woman's risk for circulatory complications and may contraindicate the use of OCPs. The rest of the questions there, B, C, and D, do not play an important role as to the determination of the use of OCPs for this particular lady. Okay, so the answer is alpha. Number 55, the community center, health center is having a series of seminars on health-related topics. You are invited to discuss BSE with a group of women. Which of the following would be appropriate to teach regarding BSE, when BSE should be performed by women of reproductive age? So kailan ito ginagawa? Mas appropriate na gawin? Is it at the end of the menstrual cycle? At the beginning? About 7 days after the beginning? Or about 7 to 10 days before the end of the menstrual cycle? When is the best time?
C, ma'am.
Letter C, very good. 7 to 10 days after the beginning, tama ba yung binasa ko? After the beginning of each menstrual cycle. So, during this time, your breasts are softer. Tama naman, di ba? Less tender, so hindi masyadong masakit or walang pain. And the swelling is reduced about a week after the beginning of the menstrual cycle. So at least with this, you are able to identify or palpate, no, if there are any unusual lumps when you will be performing your breast self-examination. Do you do this? Sabi nila, ang magaling daw na mag-BSE, lalaki. Okay. Yung mga lalaki, magaling silang mag-BSE. Tama, Mr. Abad?
It's on.
Ma'am, si Certal, ma'am.
Ano po?
Si Certal.
Hindi, pero totoo yun. Mas nakakapa kasi, no, for married couples. Let's say, for example, for married couples, or let's say, common law wives and husbands, no? Yung mga lalaki, sila yung unang nakaka-identify pag may lump or bukol si misis. Yan. Siyempre, alam nyo na kung bakit. Pero totoo yun. Ang unang nakakapansin ng changes sa breast ng babae is the partner. Okay? Kung may mga bukol, kung may mga unusual, parang pag nung nakita niya, bakit parang bangking yung dibdib niya, mas extremely, I mean, when it comes to the appearance, parang it's really different from the other breast. Yan. So, yan ang mga observations natin at mga sharing ng mga ng mga speakers natin, no? Ang mga lalaki, yung mga partners natin, they are very good in assessing, no, or in determining whether there is a lump or unusual growth sa breast ng partner na babae. Yan.
Rambam katunda nga tao.
Syempre kasi nga talaga, madam, part ng but in doing BSE, okay, kung ikaw yung gumagawa as a healthcare professional, there is the proper way, of course, to perform the said examination. So usually we make use of our what? The three fingers, okay? The three middle fingers. You have your pointing finger, si Tallman and si Ringman. Char, parang bata, no? Si pointing finger, si Tallman, and si Ringman. We make use of these fingers to feel for each breast. So as we palpate it, okay, we make use of our fingertips, okay, to identify whether there is an abnormal growth or mass in our breasts. Okay? Yan po. That is number, meron ba yun? Hindi ko alam. Timing. Yes, in number 56. Okay? I use the tips of the three middle fingers of each hand to feel for each breast. Of course, may proper positioning ito. Hindi ikaw yung nakatayo lang. so that your patient will be comfortable, she should at least be positioned on the bed, okay, lying. Nakahiga, nakataas yung isang kamay. Kung, for example, you will be examining your left breast, okay, the fingers that you would be using would be those on your right hand. Okay, so yung 3 fingers mo dyan. And then you start palpating. BSE. Hindi ko masyadong ginagawa yan. What about the ladies here? Do you usually examine your breast? Ginagawa nyo ba? O pwede nyong gawin yan. Okay, you can examine your own breasts. Kung ayaw mo, si best friend mo, patry mong papalpate. Okay? Para ma-assess natin if there are any unusual lumps or growth there in the area. Pag movable, yan yung mga dapat yung tignan. Pag ngayon, meron kang naramdaman, you try to do it again tomorrow. Okay? Baka naman mamaya enlarged lymph nodes pala dyan, nakarating ka hanggang sa kilikili mo. Okay? Breast lang ang pinag-uusapan. But if there are existing infection, actually, your lymph nodes could possibly be enlarged or be inflamed if you have existing infections. Sa dibdib mo, if there are unusual lumps, you take note if it's movable or non-movable. May indication ba to kung sakali? Okay, so if there is a need to excise that particular lump or mass for diagnostic purposes, then so be it. We will be able to check using the histopathologic studies, whether these particular tissues are malignant or not. Malapit na po. Next number, sige ma'am. Number 58, 57. The nurse has been discussing menopause with this 50-year-old woman who is experiencing some bodily changes indicative of the perimenopausal period. Which of the following statements indicate the client understands what is happening to her body? Menopausal woman na ito. Okay? So the best answer that you could give actually is that BCD in erroneous statements po yan. Okay? I am very upset. Hindi naman, yes, there may be mood swings, but this will not be happening for the rest of your life. Okay? Letter A, even though I am only having periods every few months, kasi when you reach the menopausal stage, staggered naman yung mangyayari sa system mo, sa reproductive system. It doesn't happen immediately. Now, hindi ka na magme-mens ngayon na for life. No. Even though I am having periods every few months, I should continue to use birth control at least 6 months after my periods have stopped. Okay? Kasi nga, hindi naman continuous na wala kang period or pakonti-konti or scanty yung iyong menstrual cycle. It can still be possible that with this periods dahil dinadatnan ka pa, there is still a chance that you can get pregnant. Pwede pa tayong mabuntis sa totoo lang. Okay? Pag meron tayong, for as long as meron ka pang menstruation, that will still be possible. Okay? Next, number 58. A 4-month-old child is brought to you sa health center for the next set of immunization. Which of the following would contraindicate receiving immunization at this time?
Delta.
Very good. Active infection. Okay? Since you will be, so any evidences of active infection indicates or contraindicates, immunization. Okay? So other contraindications for immunization are immunosuppression and corticosteroid therapy. So these are contraindications for vaccination or immunization. Remember po kasi na if the patient has active infection, of course, your antibodies are also active. Okay? So what is the use of introducing this vaccine to your system kung active lahat ng antibodies mo because of an existing infection? You might not be helping already the client at this point in time. So we can give the immunization kahit delayed, ma'am. Oo. Basta ibalik mo yung baby mo or yung anak mo sa health center for him or her to receive the due immunization. Okay? You will be informed naman. You will be your client will still be examined naman po by the doctor or by the attending physician doon sa community health center ninyo. Okay? So that is number 58. Number 59, the client is given Hep B immune globulin. Okay? Hepatitis B immune globulin, which will provide passive immunity. One advantage of passive immunity is that what is passive? Very good. Delta, 59.
Charlie.
Charlie. Okay. Your D is not the correct answer. Even A. Okay? For immune globulin. Hindi ko immune hepatitis B, immune globulin. Letter C is the correct answer. It offers an immediate protection. Passive immunity, okay, accordingly, provides immediate protection to the individual. Meron kasi tayong vaccine, no? Meron kasi tayong mga bakuna na binibigay that do not last for a very long time. Immediate ang ibibigay niyang protection, lalo na kung alam nating meron ka na. Okay? Meron tayong binibigay na passive na vaccine that acts or classified as providing you passive immunity. It is usually short-lived. Okay? It has limited effectiveness and does not stimulate the body to produce antibodies because your immune globulin is already an antibody. Nakuha nyo? It will not stimulate already further development of or production of antibodies because your hepatitis B immune globulin is already an antibody. Okay? Yun yung differences natin sa ibang vaccines. While other vaccines would actually produce, okay, would actually stimulate or trigger an immune response by creating antibodies, yung iba naman, they are readily available in the form of antibodies. Ito po yung example natin, your hepatitis B immune globulin. Okay? So that is number 59. Number 60, the PHN tells the client common adverse effects that may be experienced after giving Hep B. Ano yung expected effect after giving your Hep B vac? Tachycardia, heartburn, dyspnea, pain.
Pain.
Okay, very good. Pain and tenderness, pain at the injection site. Okay, so that's the correct answer. So kung yung sumagot ng heartburn and diarrhea, it doesn't apply. Even for dyspnea and URTI, tachycardia